Hi gents and followers of the Change Thinking page, welcome to this short video as I try and explain for those who are not aware of what is hypnosis. Let's make a start. So first of all, hypnosis is a way of communicating and providing suggestions to your unconscious mind. So whatever you're thinking about at any particular moment in time, that is what you're conscious of. Anything else is what's in your unconscious mind. Okay, so anything you're not thinking about lies in your unconscious mind. Now, what are the common things that people go to hypnosis for? And the most common one would have to be for people trying to stop smoking, because essentially it's about a misalignment between your conscious mind and your unconscious mind. Now, consciously, you know it's probably very unhealthy for you. It's certainly very expensive in Australia, and you probably know that it makes you smell and helps you be a bit of a social outcast at times. So consciously, you're aware of all the reasons to stop. It's just that at an unconscious level, there's this part of you that loves to smoke. Okay? So any behavior that you do automatically, without even thinking about it, lies in your unconscious mind. So that could be anything from like losing weight or getting angry or doing anxiety. If you do it automatically without thinking about it, it's coming from your unconscious. And so this is where hypnosis does get to be pretty interesting. So I've got other things there: reduce stress, drug addiction, nail biting, building confidence, and grieving. And you know what? I am just touching on the surface. Now, to blow this wide open for you, the myth about hypnosis and what it's all about, I'm part of a internet site called Hypnotic World, and I'm going to drag this into the camera there. And what I've got at the top here, we've got fears and phobias, weight loss, the top 10 scripts, but let's just have a look at all the possible topics. Hypnotic gastric band, fear of buttons, fear of cats, fear of conflict, cocaine addiction, chocolate addiction, slimmer you, fear of driving, fear of eating, healthy living, gambling, nicotine, fear of flying, weight loss. We've got a new section here, which is the psychic and paranormal. Then we've got regression and progression. Over here, we're still working our way down through the fear of snakes, fear of soiling, fear of success, and body image section. And of course, down here, we've got the relationship section, which is a big section. Finding love, ending an abusive relationship, develop empathy, business skills, grief, hypnosis scripts, habits and disorders. For example, appetite increase visualization, anorexia control. So hopefully I'm trying to open up your mind here to think, what sort of things could a hypnotist possibly help me with? And you may have some very unique little private issue going on that might be embarrassing to talk about. But there may be a very simple solution to it. So as I keep scrolling, we've got self-hypnosis, we've got health relaxation. Still looking over here, we've got fears on the left, sports improvement, confidence hypnosis. So if you thought it was just a couple of topics, which is why you would go to a hypnotherapist or someone who's skilled in the art of hypnosis, the list of subjects that you could go and get help and more control in and more choice with is literally infinite. So hopefully that was a bit of an eye-opener. So let me just explain what happens during a typical session. So in a normal session, after we've understood what's happening and we've had a pre-talk and we know what's going on, basically I'll sit beside the person having the session, because sometimes I may touch them on the wrist, on the elbow, on the shoulder, or on the forehead. But I'm right there to observe for any unconscious movements. And I'll even agree that, raise your finger for yes, or 2 taps of your finger for no. But we set up some signals to communicate with the unconscious mind. Now, at that point, the idea is to then spend the next 10 to 15 minutes just talking you down into a really deep, relaxed and comfortable state, going down, deeper down into comfort and relaxation. That's right. And as we talk our way, and this process that I'm talking about this would go for about 10 to 15 minutes. And so after that amount of time, I'm talking even slower, and you're just at an absolutely relaxed and comfortable state. Now, it's at that point we start working with the unconscious mind on whatever the particular issue is. Now, in this case, I'm going to use smoking. I think most people can understand that one. And so there's a misalignment between the conscious mind that wants to stop and the unconscious mind that wants to continue. So what we need to do is get an agreement in place. So once we get down to that deep state of that, the basement of relaxation, which is just above where you fall asleep, that's when we transition and we start to build rapport with the unconscious mind. And I would thank the part of it that's been causing the owner to smoke over the years. And I'd let them know that they've done a great job, because there's been times when the person wanted to give up, but you kept them smoking. But I also talk about the times and how they're changing, and the person is changing, and how smoking may not be the best thing for them anymore. And I'll explain why. And I get them to imagine life the other way, as being a non-smoker, not an ex-smoker. And at that point, I really ask the unconscious mind to consider the suggestions that I've provided with them. Okay? Because ultimately we want to speak to the unconscious mind that it's got a different role to do. It now needs to cut out cravings. Okay? So we make some changes and we make some suggestions to the unconscious mind while you're in that deep, relaxed state. And from there, we do some affirmation work. We just sort of cement in the suggestions that we've spoken about earlier. And then it's to bring you back into conscious awareness, back in the chair, back in the office from where you had the session. And the way we do that is to really count from 1 to 5 or 5 to 1. And when we get down to 1, we'll ask you to open your eyes. And because you haven't fallen asleep, you open your eyes. And I say, well, that was a great hypnosis, wasn't it? Now, for a lot of people, they drift off, and that's fine, because that means your conscious mind is relaxed enough for your unconscious mind just to absorb the new information that you're presenting to them. So that's pretty much what happens in a hypnosis section. I hope that little eye-opener at the start about all the subjects that hypnotherapy could help with was a bit of an eye-opener for you. Because hypnotherapy, I've seen it do amazing things. So if you're a skeptic, come on, try it before you make your judgment. All right, that's it for today. I hope that was enlightening for you.